Here is the latest advancement in the field of orthodontics. Archform Orthodontics can make your work easier and more efficient with a unique and proven indirect bonding technique for lingual and labial orthodontics. As well as being an orthodontist, you're a professional who runs a business, wants to provide quality treatment for your patients, and receive a fair remuneration for your time and expertise. This is why we trust you'll understand the advantage of indirect bonding and how you can manage your time efficiently while still providing high-quality treatments. With this new advancement in indirect bonding techniques, you can increase your efficiency and productivity by performing lingual or labial bonding procedures with precision in minutes instead of hours. This video will show you how easy we can make the bonding of full-arch lingual orthodontic appliances, individual lingual orthodontic brackets on individual teeth, and placement of temporary false or Pontic teeth in extraction situations, and placement of lingual arch wires, and the indirect bonding of labial orthodontic brackets and the placement of bands if required. After making an initial diagnosis and taking impressions of your patient's teeth, the impression is sent to the laboratory and poured into a stone cast. Specific measurements of the model are entered into a custom-written software package. Using a patented manufacturing process, the laboratory follows a series of stages that go from a patient's current condition to the desired end result. A final model is created with all the necessary overcorrections. The laboratory then positions the brackets on the maloccluded model using the diagnostic setup as the prescription for tip, torque, height and in-out. Transfer trays for the clinical indirect bonding procedure are then fabricated on the maloccluded model. Patient models can be viewed in all three dimensions to facilitate precise bracket placement. This technique-sensitive process allows your practice to take advantage of increased efficiency by emulating the precision of laboratory placement, whilst incorporating an individual prescription for each individual tooth for your patients. All this is done with a reduced chair time. "10 to 15 minutes prior to consultation, plastic bracket conditioner or acrylic monomer must be applied to the bracket base. After confirming the trays accurately fit the patient, teeth must be cleaned with either a handheld sandblasting kit or pumice. Insert parotid guards, cheek retractors and cotton wool rolls into your patient's mouth to isolate teeth effectively. Teeth may then be etched for a period of 30 seconds to a minute. Rinse and air dry. The teeth then acquire a frosty surface, which indicates the teeth are adequately etched. Use the hairdryer to finalise the drying procedure. A sealant such as Solo or MIP needs to be applied to seal each tooth for the bonding procedure. To summarise the preparation for bonding procedure, Step 1. Apply plastic bracket conditioner. Step 2. Clean teeth. Step 3. Isolate teeth. Step 4. Etch teeth. Step 5. Rinse, dry and seal. After the bonding process and the removal of trays, clear excess composite with a scaler or burr. You must floss between every contact point to ensure that excess composite has been removed. Allow the patient to rinse. To summarise the preparation for composite removal procedure, Step 1. Remove excess composite with a scaler or burr. Step 2. Floss between every contact point. Step 3. Rinse. After completing the preparation for bonding procedure, prepare a layer of slightly runny composite by adding a small amount of sealant to conventional light-cured composite. Remember to protect the composite with the orange light guard to prevent premature setting. Another option is to use a pre-mixed composite, such as Kerr Revolution, which has the ideal consistency and can be syringed directly onto the bracket. Apply a thin amount of the composite mixture to each bracket. Place the left tray and hold firmly. Set the composite material with conventional white curing light for approximately 20 seconds for each tooth. Repeat this procedure to apply the right tray. After setting, take a scaler to gently remove the trays. Start from the buccal aspect and peel off. If extractions are required, send the patient to their regular dentist for the extraction before placing the arch wire. If no extractions are necessary, arch wire may be fitted immediately. Remember to keep the tray, as it may need to be used again for reapplication in case of bond failure in the future. In this case, the bracket can be replaced in the tray, which can then be cut into a single tooth section for the rebonding procedure. After completing the preparation for bonding procedure, add composite to the base of the bracket. Position the single tray and cure with white light. After this is set, gently remove the tray. Repeat this process for other necessary teeth. To add Pontic teeth, which are made from composite, plastic bracket conditioner must be applied to the tooth 10 to 15 minutes prior to the placement. Check the size of the tooth by placing it in the area in which it is to be affixed. Trim the tooth to fit and then place it in position. Apply slightly runny composite to the surface of the Pontic tooth and the labial surface of the distal tooth. Cure with white light. Repeat this process on other teeth as required. Trim the newly inserted Pontic teeth to allow the adjacent teeth to move. To attach a lingual arch wire, attach double over ties to the anterior 6 front teeth and conventional ties to the posterior teeth. The arch wire may then be trimmed. After completing the preparation for bonding procedure, place a thin amount of runny composite on each bracket pad. Insert the tray and hold firmly. Apply the white curing light to each tooth through the tray. After the composite is set, remove the hard outer tray with a scaler, revealing the soft inner tray. The inner tray, which is usually sectioned in the midline, must be gently peeled off with the scaler. Follow this with the post-bonding cleaning procedure. To place bands on a patient, begin with an average size band to find the correct fit. Once correct size is obtained, apply cement to the inside of the band and seat the band on the tooth. Remove the excess cement and cure with white light. However, for the indirect bonding technique to be effective, separators must be inserted after the initial impression has been taken and removed prior to the indirect bonding procedure so the trays can accurately fit the patient. After the appliances are placed, the wire is trimmed and inserted into the distal braces. The centre mark of the wire must correspond to the patient's centre line. The wire is then tied into the brackets from mesial to distal. A distal end cutter is used to trim the excess wire.